Hello everyone, welcome to another dose of Dental Tips of the Week with me, Dr. Sherwin from Artistic Dental Studio. I'm very happy. I'm here to cover the topic of full mouth rehabilitation. Wow, such a bombastic phrase. The reason why I picked this topic for you is because it's a very, very costly treatment. It's a big kind of treatment, and it could be easily prevented if your dentist could diagnose early. And let's dive in because I just need to explain a little bit. Today I'm going to go a little bit more old school with my whiteboard. Basically, the full mouth rehabilitation is a kind of treatment in which we restore all patients' teeth all together in one go. And the reason why we do this is because many areas on the teeth are lost due to some factors, and we need to regain the lost function, lost appearance, and lost speech. So this is a very serious kind of treatment, and the reason why this happens is because over time, as you can see here in this diagram, this is a normal front tooth, and over time there is a kind of wear and tear normally happening on the edges of the front teeth, and the front teeth get shorter and shorter over time. The main problem is this thing happens over many years, and people normally get used to this shortening effect. They don't realize such a thing is going on unless they compare their close-up photos during smile with their close-up photos during the smile from 20-30 years ago. Then they can easily realize such a thing is happening. And that's quite normal. It happens in all individuals. What I'm trying to talk about is the case in which this thing happens more rapidly and it causes some problems. Now let's dive in a little bit more. So the reason why this thing is happening could be either normal wear and tear. The second thing could be the grinding and clenching. Some people with grinding and clenching normally lose their tooth substance at a much higher rate. And in patients with tooth loss, that's very, very important. I talked about it in tooth loss video, if you can remember. When a tooth is lost, the opposing tooth will be useless, and the forces that should have been shared by these two teeth now is being transferred to the neighboring ones, and the neighboring ones are being overloaded. This is why there will be an exaggerated kind of wear and tear on the other teeth, and the more the tooth loss is, just more number of teeth, the more we see this effect, and the remaining teeth will lose more substance over time. And another thing is the chemical attack. That's very important. Let me give you an example. When you're going outside seeing and you go around the creek, you have definitely seen big slabs of stone being carved by water. So water is, compared to stone, is nothing. But over time, it could create some grooves inside. It is not just the mechanical action of water over stone. It is the chemical action and aggravated by fluctuations of temperature. Such a thing normally happens in mouth, and this thing is even more pronounced in mouth because sudden changes in temperature, very acidic foods, and the dynamic nature of mouth. this is categorized under this normal wear and tear section, the first one. But the chemical attacks I'm talking about is not about this. It's about patients with heartburn, with reflux, and in patients who are very, very interested in fibrous kind of foods and acidic foods, people who are really fond of lemon juice or something like that, we can see this chemical attack at a very, very high rate, and it could lead to a rapid loss of tooth enamel, and it's something very, very quick. So the reason why I picked this topic is just because of this coming part. Let me just wipe this part, and I want to just draw something here for you. Okay, so let's just consider the front teeth. Normally, front teeth should have some kind of overlap. The top teeth normally should overlap the bottom ones. The reason why it should be this way is because if you consider the top tooth and this is the bottom tooth, there should be a kind of overlap between them. You can see clearly. The reason why it should be this way is because front teeth normally support back teeth and vice versa. And the reason why front teeth could support back teeth is because of this overlap. During chewing, front teeth glide against each other and cause some space between the back teeth, a very, very tiny space, and it could protect back teeth. Now, over time, what normally happens is that a part of the teeth is removed by normal wear and tear, the hashed area. So where we will end up to is something like a shortened tooth and decreased amount of overlap. In these cases, the protective mechanism of front teeth is diminished or completely eliminated. And that's when the problem begins. Your dentist is the right person to understand this thing is happening, and if this thing is not proportional to your age. All right, if we see such a thing in a 75-year-old person, you may say, okay, that's quite possible and normal. But we see this on many individuals in the age range of 35 to 50. Okay, when such a thing happens, the front teeth cannot support back teeth. So we see some wear and tear, accelerated wear and tear on the back ones. And then we begin to see some signs and symptoms. What are these? First of all, many people come to us and say there is a kind of loss of function. They feel their front and back teeth are not as sharp as they were, They're not as efficient as they were. This is the first thing. The second thing is many people, especially women, they realize there is a kind of problem with the amount of display of their top front teeth, especially during smile. They don't see as much of front teeth as they used to. The third one is some people may realize there is a diminished distance between their nose and chin. It's a kind of collapsed. This space is reduced. This height is reduced. Some people, because of the loss of enamel on the teeth, may experience some sensitivity. And also, people may experience repeated cracks, fractures of the fillings or the teeth, and dislodged fillings. These are all signs and symptoms, plus, and last but not least, pain in the joints and muscles we talked about in the previous video. So these are the things that are a hint to let us know something is going on. Something is wrong here. All right? So if this thing is diagnosed early enough, we don't have to go do this full mouth rehabilitation thing to protect all teeth because we've already lost a lot of substance on both front and back teeth. In the early stages, when this process begins, normally the front teeth are mostly affected. So what we can do as dentists is to first diagnose, let the patient know, and then do some conservative procedures in order to regain that lost tooth, from the front teeth, just to replace that missing substance, that tiny missing substance, and regain that function again. So the front teeth will be able to support the back teeth again. So that's really important. This way we can eliminate the need for such a big, costly treatment. How we can do this? The sooner the diagnosis, the better. How we can do? First of all, we can either do some fillings, as easy as fillings, or some veneers to replace that missing part of the front teeth. As easy as this. Not a huge big treatment. No, it's not needed. If it goes further, and we can pay attention to if there are any empty spaces in mouth, any teeth lost, then we need to replace them. And in cases of any kind of clenching or grinding, we can give patients something like a mouth guard or something, just trying to protect the teeth from further wear and tear. In more exaggerated cases, we can provide patients with crowns to protect teeth even further, and depending on the severity of the case, the number of the crowns definitely differ. And plates, like removable plates, as I told you in the previous videos, how it works, and it could replace the missing teeth, or implants to replace the missing teeth. So these are all the measures that could help patients regain their lost function, their lost appearance, and in many cases, their lost speech. All right, guys, I think that was enough for today. So how you can be aware such a thing is happening in your mouth just is your normal checkup and cleans with your dentist again. Always come back to this crucial point. And your dentist is the right person to tell you if such a thing is happening, because we're taking intraoral photos and compare it with the previous ones from 6 months ago, 1 year ago, or even further, and let you know if there is something happening out of proportion, and then you'll definitely understand if you need to take any action or not. Thank you very much for your attention, and please tune in for the next week's video. That will be a very, very exciting one, believe me. And that's about Invisalign treatment. I've received many questions about this type of treatment, which is really mainstream, very common these days. And I will see you at my practice to let you know about how it works and how you can benefit from it. Thank you so much. Leave your comments, share this video, and I'll see you next week. Thank you guys. Bye.